Jeff is a seasoned entrepreneur with deep expertise in healthcare revenue cycle management, product development, and operations. He specializes in leveraging both traditional and modern technologies to drive revenue growth and efficiencies in healthcare. Please welcome Jeff.
Thank you. All right. To wake you up from lunch, I'll take a bold take to start. Over the next 20 years, no one in the room is going to lose their job to AI. In the next 5 years, if you don't know how to use AI, you may lose your job to somebody who knows how to use AI. So what I'm trying to do here today is get everybody to a base level understanding of where the world is today, what is possible, and give you some frameworks for evaluating what's real, what's overhyped, what's too far forward looking, what could I do today, how can I be conversational, so you don't lose your job to somebody who can do those things in the next 5 years. There we go. Okay, so introduction, maybe I'll put it my way. I went to school to study foreign languages, to be an Army officer, to do some medical billing so I can come and talk to you about artificial intelligence. In my bio, I am not an engineer. I've never been an engineer. I have been a product owner many times over and have brought 8 or so software products to the market. So hopefully I have at least some credibility there to talk about what's possible and where we're going. So I will try to lay a platform of what are the current tools and capabilities. We'll talk about automation gain and how I would propose you measure your own projects, your own initiatives, so that you can be confident that you are making progress. And along the way, we'll do some use cases that I'd suggest are in the RCM space, what are kind of the prime best use cases for the new tools available. And then along the way, hopefully some wisdom and probably some dad jokes too. I tend to lean on dad jokes. Okay, observation here. Over the last 10 or 12 years or so, lots of claims, lots of initiatives. Healthcare executives would say, we have invested a lot in automation. A lot of money, a lot of time, a lot of resources, with expectations that we would be able to reduce headcount, achieve revenue outcomes, et cetera, et cetera. And very often, there's disappointment in the actual returns when you get to the far side of an implementation. There's a lot of reasons why this is the case, but the fact is, more often than not, investments in automation have actually yielded a negative return. And there's probably a lot of people in the room that bear the scars of having been through some of those things. So, like I said, the idea today is to arm you with some frameworks to help you not get more of those scars. Maybe the second one, there were announcements this week making claims, like super bold claims. I saw one this week about we are automating 70% of tasks in RCM. And I don't believe you. This is not true. I don't believe you. The state of the industry is not there. Super powerful tools are here. More powerful tools are coming. But claims like we're automating 70% of all RCM tasks are not credible. Okay, so 70%, I'm saying this is a bad way to measure that. How do you measure it? Someday I hope to be famous for coining a phrase, and this is my attempt here. I Googled it. I don't think anyone else ever said automation gain before me. So what I mean by automation gain is the net savings that you're able to harvest. And so one thing that's important here is that you actually make harvestable improvements. And the second piece is that you subtract all of the costs it took to get you there. Obviously, there could be vendor costs, but there's software development costs, there's implementation costs, there's the cost of administering those new programs, et cetera. You subtract that, but first you have to actually be able to harvest some gains. And my suggestion here, if you're talking about automation, the purpose of automation is to do the same amount of work at less time cost, less labor cost. Tons of vendors in the RCMs, backing up, RCM space is typically 2 or 3 or 4% of a healthcare organization's budget goes into managing the revenue cycle. 100% of the revenues of the health system go through the same revenue cycle. So you have this thing where you spend 4 cents to collect a dollar. And so vendors in our space tend to say, if you use this technology, your revenue is going to go up by $10 million. My suggestion, if you're pursuing automation, don't measure your revenue gains. First, is it economically viable just by the savings in headcount or the savings in fees to other vendors, et cetera? You need to start there. Here's why. If I'm making a claim, your AR collectors are going to collect 5 times as much as they do today. If you could do that, just go hire more AR collectors, right? If it's a software that makes them twice as effective, if you can actually collect 5 times as much, the first thing to do would be go hire that many collectors. And then you should implement the software and cut the cost of that in half. That's the starting point. Okay, so the framework here is you need to actually save time. If you save time by stopping doing one thing but you add 4 other things, you're not saving time. If it turns into revenue gains, that is great, but that is not the same as cost savings. All right, I'm a nerd, so let's get to the first nerdy illustration. I am going to suggest whenever you undertake a project, you map out the steps of the project. And that is the full process, not just the one little thing that you're pursuing automating. This is a use case that I've been dogging for 10 years now, because about 10 years ago, when bots were the hot thing, the number one use case was everybody's got all these collectors that go to these websites and check the status of a claim, and they do this hundreds of times a day, but it's really easy for a bot to do that, and it's relatively cheap for a bot to do that. Let's have bots do it, and you'll just spend a small amount of money on this technology. You'll get all sorts of gains. And so I would say what you need to do is actually map out the whole process. This is overly simplified, of course, but map out the whole process. And what we're really talking about in that example is automating one step of the process. And if all you did was go find a vendor that has bots that do claim statuses, and that's all you did, you probably harvested 0 gain, and you took on some vendor costs or whatever you spent to build your own robots, and so you had a cost with no benefit. That's a negative return on investment. That's bad. That is not automation gain. So I like to dog this example because if you do just the automation of a simple task and you don't connect it to the before and after steps, and you don't do all of the integration work that you have to do, you will probably end up where I started at the beginning. Lots of investments into technologies and little gain to show for it. Okay, I dogged it pretty bad. I'll just say, if you implement these things well, it's a good concept. And if you actually implemented those technologies really well, you can harvest gain. It's probably not, some of these claims we automated 70% of the revenue cycle by just doing that one task with a bot is the point of the illustration. Okay, so I said I'd try to give you a good foundation of the tools that you have at your disposal. Here is my list. I'm going to take a few minutes to kind of go through all of them. This is part of everybody speaking the same language, understanding the tools that are there. Number 1, predictive analytics and machine learning. These are, I would say, the hottest buzzwords of 2018, 19, 20. I don't know, maybe go on to 2021, somewhere in there. Predictive analytics was the hot topic. And people throw out these terms to mean almost anything. I'm going to actually suggest it's pretty simple. I want to walk you through something. Predictive analytics is just simply predicting one outcome based on past experience. It's something you do all the time. There's some pretty cool math behind it. The math is not new. The math has been around for literally a couple hundred years at this point. We just didn't have enough data logged to perform the math against until the last decade or two, and we didn't have computers powerful enough to crunch the math quickly enough to make it harvestable. But predictive analytics is simply making a prediction about one thing based on past experiences. Here's how you do it. You collect lots of data. Let me use this example. Presumptive eligibility was a hot topic 5-8 years ago. This is a great use case for predictive analytics. What a bunch of companies did, now it's about 20 years ago, was they took all sorts of data about patient payments, and they ran a regression analysis, a statistical analysis of what are the best predictors of, is Jeff going to pay his copay today? Turns out, zip code, employment, and past payment of your medical debts, these are the best predictors of who's going to pay their medical debts. And so what you do is you collect lots of data, lots of instances of, we sent a statement to all of these people, and here's the ones that paid. You collect all of that data, and you run a regression analysis to say, what are the factors most highly correlated with paying your copays and deductibles? And it turns out zip code is a huge predictor. Past performance of paying your debts is a huge predictor. Employment status is a huge predictor. And almost nothing else matters, it turns out. Okay, that is predictive analytics. One more bit on predictive analytics. How do you apply this? How you apply it is you have a new instance. Jeff owes a copay. And you have all this past performance, and you just say, how likely is Jeff to pay his copay based on my past copay experiences, my zip code, and my employment status? How likely is Jeff to do it? It turns out, if we did it for everybody in the room, the prediction would be amazingly accurate. 95+%, 98+% accurate. If we did it on all of us in the room. If you do it on just me, it would say something like Jeff is 60% likely to pay. The problem is, I'm either going to pay or I'm not going to pay. And it's just saying Jeff is 60% likely. And so to predict one instance, it turns out it's not great. Populations, what is the value of this receivables of $10 million of patient balances? Super highly predictive, super useful. Strategies for this population that lives in these 8 zip codes, and I'm going to handle them wildly differently than the rest. Really good, really effective for that. Predicting Jeff, not so great. Okay, predictive analytics. Hopefully that gets you from the 1980s to 2018 or so. Machine learning. Anybody want to take a stab? What's the difference between predictive analytics and machine learning? Just one difference. Put in a feedback loop. That's it. Put in a feedback loop, and the simple part is let's just add a mechanism where every time there's another copay, we're going to measure it, but because now we're going to do this with more detail, it's going to be more precise, and over time, the logs will allow us to get a little bit better at predicting. And so it's a feedback mechanism. First, you have this history that allows you to make predictions. Then you have one instance, you make a prediction about that instance, and you remember your prediction. You wait to see, does Jeff actually pay his copay? And when we get to the other side of it, you make a small incremental improvement to the predictive algorithm. The only difference between predictive analytics and machine learning is a feedback loop. One thing that can make machine learning more valuable is when I did that original study to come up with the original algorithm, I only had access to the data that I had at the time. If you add a machine learning loop, you can add, I would like to collect these other 3 types of data. How did we ask Jeff to pay his copay? Did we give him an estimate ahead of time? How good was the estimate ahead of time? And so now when I'm logging these new instances, I can add a richness of data, and that will help me make my model better and help me to make tweaks to the process along the way, and I can get a little bit better and a little bit better over time. Okay, I'm not going to take quite as much time on the rest of these. I'm going to come back to generative AI to talk about language models. That one I will take as much time. Generative AI is the hot topic of the day. Spring of 2023, GPT 3.5 is a thing. OpenAI says we've got ChatGPT. Hopefully by now everybody has played with it. If you haven't played with it, tune out half of this and on your phone, download ChatGPT and start playing with it. Because you need to get conversant on it. I'm going to come back and go a little bit deeper on this. RPA was the buzzword. Let's call it towards the end of the predictive analytics initial hype, let's say 17, 18, 19, and 20. People started calling it AI. Here's my definition of robotic process automation. It is simply programming a computer to mimic the keystrokes and mouse clicks that a human would perform. It really isn't much more than that. You may have heard the term computer vision. When a person is at a computer, you look at the screen and you read things, and then you click. Computer vision is just the computer's way of looking at what's on the screen, making some interpretations. Character recognition and image recognition are embedded in the modern RPA platforms. And these are simply ways of interpreting what's on the screen to enable those programs to do the clicks and keystrokes you want them to do. They are relatively crude. In general, it's just a set of instructions. Those instructions can have branches, decision-making branches. If the value is greater than 100, do these. If the value is less than 100, do those. And so you can get a little bit more context-aware, context-specific. At the end of the day, though, it is just simply a set of instructions to make keystrokes and mouse clicks on a computer, no matter how embedded the logic can be. Okay, that's RPA. Business rules management. When was this invented? Sometime around the Post-it note. When you need to remember something to do your job, and you know you're going to come back to that same type of decision or that same piece of information, you write it on a Post-it note and you put it on the wall. If you tend to do this a lot, or you have staff that do this a lot and you want to communicate instructions to them, you make a grid. Maybe for registration people, it's a grid of how to pick the right Blue Cross plan or how to pick the right Medicaid plan. These are business rules. And what you're doing is you're saying, this is a decision that you make repeatedly, and I want to narrow the focus so that you make the decision with less errors more consistently over time. And so I'm going to capture it on a piece of paper, and I'm going to distribute it to the team as a job aid. If you can type it, if you can write it down, you can teach a computer those rules. So there are much more advanced forms of business rules management, but essentially, anytime you need to make a decision and you codify how do I make that decision in writing, you're establishing business rules. APIs. Anybody who's been through any implementation of any technology knows the hardest part of the process is getting two systems to talk to each other. APIs are modern ways of taking two systems that don't inherently talk to each other and allowing a simpler way for them to talk. It's interoperability. Doesn't make many headlines. APIs get better every year. They've gotten better every year for more than a decade. people don't get, it doesn't get the same kind of headlines. I suppose FHIR is the most recent, like, large-scale type set of APIs that is getting good headlines because it's quite good, quite easy to work with, quite reliable. But APIs are simply making it easier for different systems to talk to each other. The last one, business intelligence is also not a new thing, but business intelligence to me means something slightly different than analytics. 10 years ago, if a finance leader said, I have an analyst, what they meant was they have a clerical type person who will go and gather tons of data and type it into a spreadsheet and then maybe do some summarization in a spreadsheet and then give it to me, the finance leader, who can do analysis. The analysis is the business intelligence. The gathering of the data 15 years ago, even 10 years ago, 20 years ago, that was all done by having analysts go out into the field and collect data points for you. Today, Epic logs everything. Cerner logs everything. You can export that data really quickly. So the important thing about business intelligence to me is that a business leader can spend their time doing analysis, and very few people are spending their time collecting data to enable doing the data analysis. If you have good sets of KPI reports, you pull them up, you know how to read the dashboards, and your eye inherently goes to the hot spots, and you have the ability to click through certain things to drill down to levels of detail that allow you to make decisions. And you're not spending your time going in, oh, we need to collect, we need to go do a study, we need to go do a bunch of analysis. You're doing it on the fly. That is what I would call business intelligence. Okay. Questions? Keep driving? All right. I said I'd come back to Gen AI. 3 years ago, 4 years ago, when people said AI, they generally meant robotic process automation. 3 years ago, 4 years ago, when people said AI, they generally meant predictive analytics. Today, when people say AI, they're generally talking about large language models and applications that are using large language models. This is a really confusing thing, and you can spend a lot of time trying to research to get. So I'm going to do my best here to equip you with what is an LLM as quickly as I can. First, what is it and how do you establish an LLM? This is what you do to make ChatGPT. First, you get tons of written data. Every New York Times article ever written, every tweet ever tweeted, every Facebook post ever written. You go get all of that data, all of these written documents, and you make an assumption. The assumption is the way that those words are written, the way that those articles are written, those sentences, those paragraphs, are an accurate representation of the human language. Then you get these massive computers, and you develop a way to measure how are all of these words related to each other. When people say Llama has 7 billion parameters, the 7 billion parameters is the 7 billion different ways that the words are connected to each other. It's just a really sophisticated statistical model. And so an LLM is simply, we took millions and millions of words of text, and then we ran a bunch of statistical analysis to say how is each word connected to the other words. And when you do that, what you can do is you can have a computer predict the next word. We'll do a little practical exercises. It'll be harder for the people in the back, but I want you to finish the sentence here. Jeff's eyes are... You prove my point. Every time I do it, people are, well, they're blue. And I was going to say, well, they're nearsighted is what they are. Nearsighted. Here's the point. You knew the most likely thing I was going to say. Jeff's eyes are blue. Some people said pretty, I think. That's the one I'm going to remember. Thank you. Please call my wife. You have heard the phrase, somebody's eyes are, thousands of times, and it's always followed by a color, and occasionally pretty, occasionally closed or open. And any of those words makes sense and has meaning. But the most likely was, if you could see my eyes, the most likely was Jeff's eyes are blue. And so you had this algorithm. That is what ChatGPT is doing. At the nuts and bolts. It is statistically inferring what is the next likely word. And so when you type into ChatGPT, you're giving it entire sentences, maybe even paragraphs. You might even hit the little plus and upload a document. And when you're doing that, it is simply predicting the next chunk and the next chunk and the next chunk and the next chunk. And because it is interactive, you might say, no, I don't want to talk about that. I'm an eye doctor. I want to talk about nearsightedness and farsightedness. And the difference between filling in a sentence with blue or closed, the way that you make a better prediction is by giving it more context. And the more context you give it, the more likely you are to get an accurate and meaningful response. Okay, that's a long explanation of what an LLM is, and there's varying levels of sophistication on how these things operate. We can come back at the end. I'll leave plenty of time for discussion, Q&A. So it's really good at predicting the next word or the next phrase or the next sentence. And the more context you give it and the more feedback loop you give it, the better that will be. It's inherently quite good at translating. Google Translate was actually really good before the LLM craze. It's actually not that difficult to make translations now. I think in the UN, it's like in real time, where someone speaks in Swahili and everyone hears it in Russian or whatever their native language is in real time. So it's quite good at that. It is great about, here's a 100-page, this is near and dear to my heart for the business I'm in today, here's a 100-page document on what the evidence says is the best way to treat this disease. Here's 100 pages. Summarize it in a one-page executive summary. It's quite good at summaries and responses. If you don't already do this, if you're an executive, if you don't already run, before you send an email to a lot of people, if you're not running your draft through a Gemini or a ChatGPT, you should do that. You should start doing that. Okay, this is important. The language model doesn't actually know what these words mean. It does not understand. When people talk about these things, they often say, well, it understands. And that's what they mean by giving it context. Giving it context, all it does is give it more words and a larger sample size to use those 7 billion parameters to make the next prediction. It doesn't actually know what blue looks like. It just has lots of associations of these are things that are blue, and there are these colors in computer colors, and this is the word blue, and I'm going to associate those things. It doesn't actually understand the meaning. Okay. I'm seeing this less in the last 6 months, but like a year ago and 2 years ago, there were all sorts of articles and commentary about, well, what is the definition of artificial intelligence? And there were all these like really complicated, super nuanced of like, no, that's on the side of not artificial intelligence, and this is, and nobody got to consensus. So I'm going to make it simpler. It's just what it says. Intelligence that is artificial. It is a computer simulating intelligence. It's not actually thinking. It's just using statistical models to make its best prediction about what these are. So I say all of this, and I stress this bit about it doesn't understand what the words mean. It just has more context, meaning more words to make comparisons to other sets of words. and it's actually simulating. And so you hear this less in the last 6 months too. So when people would talk about hallucinations, now it comes up more in the forms of like, that's not a very good response, or it doesn't have the precision that I was looking for in the response. The root of those, I'll call them errors, is it doesn't actually know what those words mean. And so what I wanted to get to with all of this bit about the tools of the trade, here's the point I really want to drive, is that any one of these tools has a set of strengths, and they all have a set of weaknesses. And my analogy here is that these are tools in your toolkit. There isn't one single tool that is the tool to rule them all. If you hired a general contractor to come and redo your kitchen, if they came in with a hammer and only a hammer, you have an idea of how this is going to go. Hopefully there's a set of blueprints, a plan. Hopefully there's measuring equipment. Hopefully there's a saw. It's all of the tools working together well that are what will lead you to an improvement in your kitchen. If it's just the hammer, it's not going to do. If you try to use the hammer as a saw, you might be able to cut the wood in half, but it's not going to be pretty. It's not going to be what you were hoping it to be. And this is the case for all of the tools. At the beginning I said like the scars from bad implementations of software. My suggestion is this is where those scars often come from, is expecting the hammer to be able to do more than what a hammer can do. And all of the tools suffer from this. Keep driving? Okay. So, how do I know if this is a good approach, if this is good technology, if this is the right approach for solving a problem? I want to give you a framework for selecting your approach, selecting your vendor, selecting your build out. Here's the framework. I said at the beginning, I already did one little flow chart there, map out the process. How do I know if this is a good task for automating? First, evaluate the complexity of the task. This is how I'm going to call this your measurement of complexity. A sequence is when you give a baker a recipe, it gives the exact measurements and it gives the exact instructions of how to bake that cake. And if the baker follows the recipe the same way every time, it's the exact same cake every time. There will never be a difference. These are the simplest tasks to automate. No decision making, just follow the recipe and bake the cake. You should get the cake. You should expect the same cake every time, because if you do it the same way, you'll always get the same result. A great tool for this is robotic process automation. It's great at that. Business rules matrices. It's never the case that you're just baking a cake. There's always a decision to be had. You always have to make a decision. And I use the example of the Post-it notes. In registration areas, it's often like an insurance grid. In cash posting, it's a set of transaction codes. In the call center, it might be like if this, do this, if this, do that. But whenever you have to make a decision, if you can write it on a piece of paper, if you can put it in an Excel spreadsheet in a grid, that's a rules matrix. That's a decision matrix. Decision trees. There's almost always more than one decision that has to be made. And so you end up with this choose your own adventure novel. If you remember these from second and third grade, I've got kids, so I remember these well. These books are like 200 pages, and when my daughter was in second grade, she'd finish them in like 15 minutes. And the point here is you read 2 or 3 pages, and then it's like, if you go into the lion's den, go to page 7. If you don't go into the lion's den, go to page 30. And then there's all like decision after decision, and you end up with like, my daughter could read these things in like 15 minutes, but the book was like 250 pages long. The point here is most of the processes in rev cycle management are actually one decision that leads to a subsequent decision that leads to a subsequent. And so when you try to document what's the right way to register these patients, what's the right way to do a financial screening, you end up with like this large SOP, and you're like, I thought this was so simple. And the reality is that there's nested decisions. The more branches to the tree, the more complex it is. The more subtle the decisions are, the more you have to document the subtlety in the go left, go right. It's not always a A or a B. Sometimes it's A, B, C, D, or E. Which one is it there? You often end up combining all of these things. The last one is a cognitive decision. Let's call it human judgment. And probably in everyone's patient accounts departments, there's somebody who calls a commercial insurance about really tricky cases where you're not contracted and just settles, just makes an agreement. And how you teach that person to make those settlements is super subtle. Because what you're trying to do here is, I just want to clean up these receivables. I just need to get this case paid. I know I'm going to get it paid. I don't know how much I'm going to get paid. And so I'm trying to get the most amount of cash as I can without failing, because failure means I don't get paid and it stays on the books for longer. And so this is a really subtle type of decision. And you're trying to equip somebody with all sorts of tools to make this subtle decision. This is a cognitive decision because it requires historical training. It requires judgment of how is this situation like the guidance, the broad guidance that I've given it. These are really difficult to teach computer systems to do. The last point, the last slide was on the large language models. Large language models, because they do a really good job of interpreting text, they are enabling a lot of these decisions. I would not, if anyone's recording, I am not suggesting to have Gemini make these phone calls to the insurance companies and negotiate settlements for you. Gemini is not ready to do this. But there are other types of decisions that you just need to feed in a bunch of text that this is now possible to do thanks to OpenAI and the others with the language models. Yeah, sure. Yeah, please.
You talked about RPA and the sequence. So for
Yeah.
rules matrix, decision trees, what's the type of platform or for those?
Yeah. These aren't necessarily one-to-ones.
Right.
RPA is great here. Business rules management tools are good here. The thing with business rules management tools is they're usually a functional area within a broader set of tools. Decision trees are just simply building the if-thens into your RPAs. Let's call it setting up your processes. And LLMs are the only thing that's capable of doing this. Let's layer in here. I had predictive analytics. Predictive analytics can be very useful to embed in the workflow to make the decision. The example I used before is a good one, the presumptive eligibility, because you can use a tool like a Paro score or a credit score to make the decision, are we going to automatically give this person charity or are we going to go through a different process? And so you can embed those into individual steps. Did I hit all of them? Interfaces can allow you to go through the branches where you have one workflow in Epic and then a separate part of your workflow in some other documentation in some other system. I think I got them. Business intelligence, just measure everything on the back end of it. Yeah, good point. Okay, so this is how complex is the task, which is a nice way of saying, is it worth trying to automate? The further to the right, the more expensive it's going to be as a rule of thumb, the more expensive it's going to be. There's limits to that. I would say directionally, the more complex it's going to be. But this, let's just say it's a proxy for how much effort, how much cost is going to take to implement. My one caveat, LLMs are actually extremely inexpensive. And so if you can automate a task using LLMs, it's probably very inexpensive. LLMs by themselves make horrible workflow tools. And so they need to be embedded into some other type of workflow. And just frankly, the providers that provide tools that you leverage LLMs, they are not great. They're not all that well integrated. I got to look at Epic's appeal writer, and it's an implementation of it, and it's just okay. They tend to do better later than their first iterations. In general, the LLM tools are not all that well implemented with the other systems. Okay, let me take it a little bit further here. The left to right is kind of complexity. It's not a bad proxy for how hard is this to do, how expensive is it going to do. Let me just add the vertical here. How many consultants in the room? Yeah, these are for you. Can't be a consultant without a 2x2 matrix. So the vertical is how frequently do you do that task? And you can put them into the quadrants of, well, if we do it all day long, repeatedly, and it's really simple, we should automate that. Green, if we hardly ever do it, and it would cost $1 billion to, this is a simple concept. This is not that hard to get your head around. I'll just say, back to those scars from selecting tools to implement that didn't go so great, maybe go back to the basics on, is this a good use case? Is this going to work? Here's the bad news about this. This framework makes it seem like really easy. The bad news is all the green, you've already automated those things pretty much to the extent that you can. It's already part of Epic's core functionality. It's already part of Cerner's core functionality. If it's truly high volume, high frequency, and it's low complexity, you've already done those things. So the reality is we're really in the yellow world. Stay away from the red. You'll get more scars there. You're really in the yellow. And so to make it a little bit more complex here, the way you harvest the yellows is you use the separate tools of the toolkit together. The example on the presumptive eligibility bit is I have a predictive model that can predict, is this person going to pay their copay? And I'm going to combine it with my workflow, and I will automatically run a Paro score or a credit check score, and I will automatically route a certain population down the charity path, and I will use some automation script to post all the adjustments. And so inherently, there is some engineered processes there are inherently some processes that automatically classify going to qualify, not going to qualify. That is automated. It is embedded with your workflow system, and it makes the majority flow. Automated agents and human-in-the-loop processing. This is what I mean by the top right. UiPath is one of the RPA vendors. They call it attended automation. And essentially what you're doing here is we have a workflow. It might be a workflow in Epic. It might be a workflow in some ancillary. But I'm working my way through the workflow. And along the way, certain steps kick off that presumptive eligibility credit score check. Those are automated. And then the step of the process that can't be automated is put in front of my eyes in a way that I can quickly make the decision. On the farthest right, the cognitive decision that somebody with judgment needs to take a look at this, process the data, and make the decision. And then you can push it back into the system so that the adjustments get posted properly, or it gets routed back to coding to take their further review. The query goes back to the physician for the CDI process, et cetera. Okay. I think that's it on the frameworks. Keep driving. More questions? You can keep them coming as we go. I don't mind that the curveballs along the way. Okay, so I gave you an example that I kind of dogged on. Let me give you a second example that I really like, and I want to tie in the modern, the language model stuff. Clinical appeals are one of my favorites because most denials for clinical reasons are expensive cases, so there's a lot of revenue at play. Most organizations have a relatively sophisticated process to make an appeal. A lot of places only use nurses to write their clinical appeals. So there's a certain level of complexity, a certain level of training required to do the test. So it's an expensive task to go after. By having both an expensive task that also can generate a lot of revenue, inherently it's a great financial case. Because some of the decision-making steps along the way mean go read the medical record, maybe go read some payer policy documentation, maybe go read some journal article someplace to make a better argument. This is highly cognitive, highly language embedded. So with all of this, it is a great use case for a modern technology stack. Anyone want to push back on the 20-minute bit? Depends who the audience is. If I'm talking to UR nurses that appeal level of care downgrades, that takes 2 hours, that takes 3 hours. If I'm talking to a medical biller doing a $200 lab denial for medical necessity, I do those in 4 or 5 minutes. So the range here is huge. I needed to put a number on the slide. So I'm going to say takes 30 minutes, and we're going to try to save 20 minutes. Okay, so what I suggested before is to map out the process. I'm not talking about just the process of writing the appeal. I'm not talking about just the step of go pull the medical record and review the chart. I'm not talking about just the step of compare the payer's policies. I'm trying to map all of the steps of the process. This is a simplification for sure, but I think this is how, if I were standing up a team to go do this, I would start by make sure you really understand why it got denied. If you don't address the underlying reason, you're probably not going to win on appeal. There's probably a policy somewhere that says this is what the standard is. You need to go get the chart to see if you met the standard. Do I have good grounds to make the appeal? I think there's some level of decision. I wanted to put a decision in here. I would say appeal everything, just my personal bias. So maybe take out the decision tree, but I wanted to put one in here. So I said maybe sometimes you don't appeal it if you think you don't have good grounds. I would appeal it anyway. You write your justification based on all these other things. You usually have to put a cover page and back it up with the individual record elements. And then finally, you've got to get it. So let's observe, maybe watch some of your follow-up team or your appeals nurses, watch them do 10 or 20 of them and update your chart. Maybe pull out the old clipboard, the old stopwatch, and how long does each of these things take? I put my icons in here for what type of task is this. It kind of gives you a sense of like, oh, the policy documents in LLM could read all 892 of Aetna's clinical policy bulletins in an instant. They could read all 892 of them and understand which one is the one applicable to this case. An LLM would be great at going through all of the medical record, not just the most recent progress note, or not just the post-op note or the H&P or whatever, but would go through all of the medical record and pull out the key pertinent areas. An LLM, armed with those two things, could actually write a really good appeal, especially if I gave it a template to say, your argument needs to do these 5 things. It could write a nice appeal. So hopefully you're seeing how, first, you map out the process, Establish each step of the process. What is the right way to do that task? Align it with, do I have a tool that could do those? And then you can come out and say, can I actually pull this thing out? I came back on here and said, oh, like assembling the chart and uploading it to a payer's web portal. It's a great tool for an RPA. I kind of hit the ones about what language models are good at. This, I believe, is a great use case for modern automation. This is for the finance nerds. I'm not actually going to take you through the spreadsheet. If you want a copy of the spreadsheet, email me and I'll give you the spreadsheet. I wanted to tie this back to automation gain. You do your map. How much time can I save by automating? The vertical on my 2x2, how many times am I going to do that? Will I actually save it? You need to build some sort of model to do the pros and cons. This is what I'm going to spend to go develop that automation or to buy it from this vendor or to implement it in Epic, whatever steps you got to do. This is what it's going to cost to go do those. This is the future time cost of doing that process, and what's the net difference in those processes. If you see that there's net automation gain and you see it's compelling with a great ROI, do the use case. Let me give you one more use case here for the front end, getting the auth up front. Again, I know this is oversimplified, but for the sake of time here, what do I think they do? I think they go to some sort of grid. When does this payer require an auth? What is the requirements? How do I go obtain that? Do we have in the medical records, do we have the justification? Have we done the things that need to have been done first? The 5 times therapies, the lesser intervention, the generic drug, whatever. Have I done those things that I know I'm going to get the auth? I submit my request. It might be a phone call. It might be a fax. It might be a web form. I have to wait for the payer to do their part of the process. Did they give me the auth? Of course, many of these steps you have kickouts because you can't get it done the way you wanted. Finally, we got the approval and everything, so services happen, and then maybe before we actually bill out the claim, we'll make sure that the services that were actually rendered equal the services that we thought, so the authorization actually covers the services that really happened. And if something changed along the way, we have a way to intervene and before we send the claim out. So something like this is a pretty good authorizations process. Get the old clipboard and stopwatch out. How long does each step of the process take? Do my little mapping of, are there different tools available to us that we could do these things? And I didn't do the spreadsheet. I didn't do the full mapping out here. But I would suggest this is another case where the modern toolkit, you take your workflow management systems, you take your decision support matrix technology, you take your RPA automations, and now that we have LLMs, you can do much of this process, much more of this process can be automated today than pre-2023. Questions? Keep going? Okay. Time hack. Push me along if you don't want to go too deep on this. The most modern stuff, I want to go back to the language models, and I want to just push it a little bit further. I said, I think it was March of 2023 when GPT 3.5 came out, OpenAI said, ChatGPT. People started playing in the spring of 2023. This is only 2 years ago people started playing with it. And there were all sorts of hallucinations. Hallucinations meaning Jeff's eyes are, and it would finish it with bonkers, zebras, something that makes no sense whatsoever, but somehow in the statistical model, you'd get stuff like that. And so over the last 2 years, researchers have been doing a ton of work on how can we put left and right limits on the system? How can we put bumpers around the system to keep the tools in bounds so that you don't get crazy things like Jeff's eyes are zebras? So there's a few of these concepts that I'll kind of run through them here. The first bit is I said if you gave the LLM more context, you would get a better prediction. And instead of just saying Jeff's eyes are and hoping they're going to say blue or hoping they're going to say nearsighted, you might add more context, and that more context might be, oh, Jeff went to the eye doctor last week because he drove through an intersection because he couldn't see the stop sign. Then you're much more you add that context and you're much more likely. So the first concept around LLMs is the more context you give it, the better. Some of the use cases I've been referencing here, if you're writing an appeal letter and you give the context of, if you're writing an appeal on a particular heart surgery and you upload journal articles about that one particular type of heart surgery and you upload the United Healthcare policy on that, it's going to write a better appeal letter than if you just say, hey, we got denied for this. So this is what I mean by context. Let me just take it one step further. Everyone heard of RAG? It was really a hot topic a year ago, and I hear it less now because people are just inherently doing this. RAG is just adding more context. I need to make a picture of this, but you have the language model. The language model is not the 1 million New York Times articles. It is a model that synthesizes all the learnings from those articles. So when you say the Jeff's eyes are, it is pointing at the model. It is not pointing actually at the underlying New York Times articles. RAG is attaching an article itself. It's attaching the payer's policy, uploading your contract between Humana and the health system. So when you ask the language model to do a task and say, does our contract with Humana support this? It will actually look at those words. The language model doesn't know anything about your contract. It is just how are all the words related to each other. And then it points at the contract itself. It is a form of added context. Okay, that's what RAG is if you hear it. A year ago, RAG, we use RAG. But at this point, everyone is. And so you don't hear it as much. And I think the point to drive home is when you're evaluating systems, is their ability to give that system more context. Because if you give it more context, it will be more accurate. This is a good point to say. How accurate are these LLM systems? Anybody want to take a stab? Measuring accuracy of these things is really hard. Defining accuracy is really hard. I'm going to just generically say, if you wanted to do something with quality that you'd expect of your staff, how likely is an LLM to do it? Anyone want to take a stab? I would say it's about 60%. 60% is not great. If you put all of the bumpers around, and I'll go through the rest of these techniques, and you use the rest of these techniques, you can get to more like 85%. How accurate is character recognition? Back to the RPA and the accuracy of bots and computer vision. Anybody want to take a stab at that? It's like 97, 98. And it's pretty high. It gets a little bit better every year, but it's not going to get a 1%. Yeah, it is not getting much better, and there's not much more you can do to make it. And 6 or 7 years ago, it was only like 85%. We're over 95. It's like 97 or 98%. By the way, computer vision isn't only character recognition. A lot of times computer vision is just, that web page is HTML. HTML is the language, like that's the actual characters that come across. And a lot of times in HTML, there's more information than just the text. There's like instructions about make this bold, make this, there's links to where does this go. And so computers can actually do things like, I know that's a button. If you're asking me to click a button that has the letters submit on it, it can actually do that really accurately with computer vision. That style computer vision is basically 100%. It's only if you have 2 buttons that have the word submit, and then you can do techniques to make it more accurate. Okay, sorry for the tangent here, but just adding more context and RAG. Those are the majority of going from the 60-ish% to the 80-ish, 85-ish%. Okay, fine-tuning is adding a machine learning loop to the use of LLMs. I'll reuse my example here on the appeals bit. If you start with the base language model and you give it the context of here's a policy on that heart procedure, and I want you to write an appeal. It will do a nice job because you gave it context and grounding, and you gave it specific. This is what I want you to do. If you take 1,000 appeal letters and you label them as this is a good one, this is a bad one, this is a good one, this is a good one, this is a bad one. If you label those, this is a way to make the use of the LLM better. You can do things like, here's the input, a part of a medical record, and here's the output, the appeal language. And you can make thousands of them, and you can label them as these are the ones that were good and these are the ones that were bad. And then when you do your generation, you will get increasingly better responses. This is what fine-tuning is. Multi-agent, you can have some fun with this. Multi-agents is, I want you to have different points of context. And so when I review this chart, I'm going to have agent 1 review the chart as the nurse, as an appeals nurse. I'm going to have agent 2 review the chart as the physician that performed the procedure. I'm going to have agent 3 review the chart as the claims processor at the insurance agency. And so you can have 3 different points of view. You can give each of those agents its own type of context of what it means to be an insurance processor, what it means to be the physician surgeon, et cetera. You give it their own sets of context, and then you ask the agents to agree on what is the best analysis of this medical record. That's what multi-agent is. Chain of thought reasoning is when you simply iterate, giving better instructions through, oh, well, now that you've decided this, now let's add this flavor to it. And so by doing some iteration, you can hone in on what good looks like. Multimodal, now I can, when I'm in my car and my kids are arguing in the back seat, I can put in the earbud and I can just talk to Gemini. I can just talk to ChatGPT and I can say, I want you to draft this email for me. Here's the 5 points I want you to do. Multimodal just means you can upload a document, you can talk to it, you can upload an image. That's really fun. If you aren't roasting your friends by making images with these tools, you should start doing that because it's pretty fun. It's pretty fun to do that. Hot topic the last couple of months, agentic automation. Easy to predict this one. It's going to get overused. It's already probably overused. And this is just simply in my decision trees, there's a branch in the logic, and you need to choose a branch, and then you can execute your next steps. Agentic automation is just having the program, giving the program the authority and the instructions to, when you get to this point, you need to make a decision. Make the decision, and then proceed. This is probably like 4 or 5 months ago. I'm pretty sure it was OpenAI that they gave a webinar releasing their latest functionality, and they were talking about having an agent embedded in ChatGPT that would do things like book your vacations. And on their live rollout of the tool, they went through it and did the live demo. And at the end, Sam Altman even concluded, yeah, I'm not ready to have this agent book my vacation for me, because basically it was not able to pick the hotel that was most to my preferences, not picking the time of day for the flight best. And why would I, if there was a chance of it going wrong, why would I let it put in my credit card and actually book the plane tickets when I need to look at it and it just takes less time for me to click on the American Airlines app and I'm going to select the right flight. So this is hype. That you can find it. Just go on to YouTube and you can search for this Sam Altman agentic release. It's like an hour and a half. It was really meant for nerds like me, but it is interesting to go through this long demonstration. At the end, they're like, "Yeah, this isn't ready," but you can buy it if you want it. So I guess my point is, I think this is where my comment earlier about the LLM logic isn't very well embedded into these other workflow tools just yet. Epic has started to do some embedding with their appeal writer. There's all sorts of startups. I work for a startup that's doing these types of things. I'd say this is what needs to mature over the next couple of years. I put it back at the bottom again, just of knowing the limitations here, that anytime you're doing these things, what you're doing is you're making the predictions more reliable, but it doesn't mean that, now, because you told one agent to be a nurse and one a physician and one an insurance claims processor, it doesn't make it understand the words or understand that CMS reg. It doesn't understand it. It just has access to the words and the ability to make predictions how the words are related. Here's my favorite use cases. I've been around rev cycle management for a long time. And the way I came up with this list was, what are the different workflows in most healthcare organizations that have limited automation, but today you have access to the words, and you could plug in a ChatGPT style tool and could do things today that you couldn't do 2-3 years ago. And that's kind of how I came up with these with this list. I have not. Yeah. I'm recommending these things. What do I have direct experience that I can back up and with? The two that I've gone really deep in, my first illustration with the clinical appeals, and then patient status recommend. By patient status, I mean, is it inpatient or observation?
Question, so with that and as they develop, being on the provider side, we know the payer side, I keep hearing they're years ahead of the provider side. And, for years and years on, patient status and then the concurrent review, there's the infamous Milliman versus interqual criteria. We use this, they use that, and so forth. As these tools develop, trying to be optimistic, I mean, there's one scenario, whatever that criteria is, if we have it and the payers have it, then that should, again, I'm being see these replacing the infamous Milliman versus Interqual. You put one in, but they have the other. And
Yeah, several points in there.
yes.
Uh, I know a guy who's trying to replace Interqual and MCG. It's me. I know a guy, and we should talk more. We can talk more. There's an information, the starting point, payer versus provider. One layer is, I would say, the information, the data that a provider has to make broad decisions is wildly different than the data that the payers have. The lens that the providers look at that data and the lens that they're wildly different. We just did a study, hot off the presses. In my direct experience, this is an N of like 50,000 admissions. If we met criteria, as in Interqual or MCG would say inpatient, and then you bill it as inpatient, you've done all the other pre-cert stuff, faxing in records and all that stuff. The payers will deny about 5% of the time. The MCG and Interqual are supposed to be this neutral, both parties can be that. Yeah. So the payers will deny 5% of the time. Let's call that a 5% error. But that's in one direction. If you go the other direction and you say the chart, it does not meet criteria. As in, if neutral, you should bill it as observation. If you have a physician advisor review it and make the medical necessity argument, or if you use a language model to review the medical record and make the argument, you would think something like 5% of the time, right? Because the error was 5% this way. You would think it's not. It's 30%. 30% of the time. So my first, does anybody work for Optum or MCG? So my first argument is like, it's supposed to be a gold standard. If it's on this side, we pay it this way. If it's that side, and it's not true. Like it's 5% error this way and 30% error that way. That's like a 35%. It's not a black solid line down the middle. It is a gray area that is really wide, and it's super, super biased towards obs. This is my tangent off of, I don't know, an N of like 50-ish thousand cases. So one point is I would just challenge like what is true. It's come up a couple. I've used this term accuracy probably 3 or 4 different times here, and accuracy is a really difficult thing to measure when there's so much variation in healthcare in general. And so if you can here's a standard that we can all agree to. And theoretically, that's what MCG and Interqual are supposed to be. And if that standard is shaky ground to begin with, whatever you layer on top of that shaky ground is also shaky ground. Okay, one point is like information that the payers have is wildly different than what the providers have and the way they interpret it. That's one, I'd say. The second is having a standard. I think that leads me to like, I would argue we probably need clearer standards. And I would say, I mean, my bias, I work on the provider side only. I've never worked on the payer side of my whole career. And my bias is towards the payers are more sophisticated. They are using these tools better to protect their margins. The payers are, in fact, using predictive models to deny claims. You see in the articles, there are public lawsuits out there. You can see the one about diagnosis and procedure combinations. That's a predictive model. That is not agentic. That's not agentic AI reading medical records. There was an article a couple weeks ago saying United publicly said that they have 1,000 AIs in place to save money. And when an insurance company says save money, what they really mean is deny claims. Well, often they mean deny claims. So I would say the payer world, they are using data well, and they are well ahead of the provider world in using the tools at hand to do this. Did I answer your question? Okay. Any points to emphasize? No. All right. These are good. What else? Oh, come on. I said all sorts of controversial things there. Okay. Any other examples? Any use cases where somebody is using modern automation? Other use cases that aren't on here? There's plenty. Scribing. That might be like the hottest of the next 12 months or so. What else? Are any health systems using robocalls? Any robocalls that are dynamic, not just I'm leaving you a voicemail about your appointment reminder, et cetera?
Yeah, we're trying to do that right now. We're working through our AI committee to look at pre-procedure calls for all your pre-op requirements.
Yep. I don't know any health systems doing the inbound, but the phone number on your patient statements, if you have a question about your bill, it seems like a good place to start. Because the call routers today, push one if you want to, they've been awful for like 20 years. And so using an AI agent to do that, there's no way it can be worse than the push one for that. There's like no way it can be worse. So if there's any other entrepreneurs in the room, that'd be a good place to start. People hate doing the job, answering. When you ultimately get to the people that have to, that's like one of the harder jobs. Yeah. So let the agents do it. Okay. I've been doing automated systems for a long time. This AI, the LLM stuff is only 2 years old, so it's new. But I think some of the lessons from much longer than the last 2 years are applicable and will continue to be applicable. So, oh yeah, I can't believe I made it this far without saying this. I did say you should download ChatGPT to your phone if you haven't already done that and ignore my presentation and play with it. But I should have said this at the same time. Do not copy paste any PHI into Gemini or Grok or ChatGPT. Don't do it. You should talk to your IT teams, and you should turn on Microsoft Copilot. It's quite easy for your IT teams to have a BAA in place with Microsoft. Those BAAs are good. They won't train off your data. They won't send them to OpenAI. They won't do those things. And then you can have Copilot, and you're protected. If you haven't done that in your organization, you need to do that. But yeah, do not copy paste my medical records into Grok. Grok is the one that has like an attitude when you talk to it. I do not want them reading my medical records. I didn't say this one earlier. The accuracy bit. Some of the things that have people so optimistic about LLMs is it will astonish you on the level of detail. The things that it can do will astonish you. If you load a 200-page text and ask it one specific thing, it will go to that paragraph and cite it really accurately. And it's like, oh man, that would have taken me 30 or 40 minutes. And so it's like astonishing. And so I've started to say like it is more accurate and less accurate than a human. It's more accurate. The example I've used a bunch of times about reading a medical record, whether it's a CDI thing or the patient type thing, it will not skip a single sentence of a medical. It won't skip it won't skip a lab result, one telemetry read. It will read every single word, and in that sense, our tool is picking up things that our physicians miss every day. And so in that sense, it is more accurate than a person. It doesn't get tired. It's really fast. Never skips a word. At the same time, you have this problem that I've talked about. It doesn't actually understand what those words mean. These language models, they are biased to do what you're asking it to do. And so if you put a spin on it, like, is this a good thing? Then it almost always says, yeah, that's a good thing. And it's like, oh, cancer's not a good thing. But they tend to want to please. And so you have to, like I said, you have to put the bumpers around it. It is more accurate and less accurate. Okay, this goes for everything. The reason I dragged you through my flowcharts is you need to understand the process as a whole, but you need to break it into the manageable pieces, because it's in the manageable pieces that it's in the details that the devils come out, right? And so if you break it into a small component, you can handle the small component. So first, break everything down to those small components so you can. Easiest way to eat an elephant is to break it into small pieces, right? I definitely stressed this along the way enough times, right? Use a hammer to hit nails. Don't use the hammer to change the baby's diaper. Use the tool for what it was made for, because it will be good at that. I did not talk about this much. If you have a bad process, if you're getting bad outcomes in a certain area, it's likely because you have a bad process. If you have a bad process, automating that is not going to solve your problem. Why are the roads of Boston horrible? Traffic is horrible. The roads are awful. What they did was everybody walked like this for 200 years, and then they just paved over the ways that everyone was walking, as opposed to like making a grid like, I don't know, a Midwest town, made 200 years later. Okay, so first get your process right, then you should do your optimization. Optimize first, then automate. Talked about the limitations of your tools. Yeah. Take some iteration. This is probably a good comparison. Does anybody work for Epic? 8 years ago, 10 years ago, Epic was on this like vanilla. And 10 years ago, vanilla Epic wasn't what vanilla Epic. Yes, that is the right answer. You should be on vanilla. You'll take upgrades better. You can ask for help and you'll get it. You need to be on vanilla. It is the right answer. But the problem was 10 years ago, their vanilla wasn't what it is today, and it wasn't that great. They didn't understand all the different ins and outs. And so my point on this is not, I love Epic. We're Epic first. Everybody's Epic first. Great. My point is your first solution is probably not fully optimized. If you are picking tech vendors, there needs to be enough flexibility, enough configuration layer that you can adapt it to the particular needs of your organization. The last bit was log everything. If you log everything that you do, you can build in machine learning loops. You can put a BI layer on so that you can interpret the data and make better conclusions from the data. All right. Can't believe I made it this long without making any hockey analogies. I am a hockey fan. Are there any Blackhawks fans? Blackhawks fans? All right. I didn't get any free drink tickets. I will track some down and I will get you drinks. Okay, so yeah, Blackhawks fans are suffering, but 2 years ago we got the #1 overall draft pick. And he is the hope of the future. What happened with the hope of the future? Like a couple months in, he broke his jaw. And he went out for like 6 weeks. That's why he's got this helmet on here. But here's the thing. Like this AI stuff, it is the hope of the future. It may have its bumps in the roads today. It may. It is coming. And what I said at the beginning, you're not going to lose your job to somebody. You're not going to lose your job to AI, but you might lose your job to somebody like you who can use AI better than you. So you need to get on that train. You need to do it. By the way, this is a real picture. That's really me. It was an overtime goal winner by Connor, but it was awesome. Yeah, it wasn't AI. I'll prove it to you. Yeah, I'll prove it to you. Awesome. Any more questions? Yeah, we got one all the way. Of course. The next question needs to be from the front. Let's just keep Jamie running.
No, thank you for giving all like the good definitions, but you mentioned generative AI in the beginning, but agentic automation. I'm hearing more and I'm studying more about agentic AI, which is much more actionable and become autonomous. That's the one that can, if you don't put the guardrails on it, it can just run. Do you see that agentic AI become more of a play into, the RCM space? Because I've been seeing presentation where it can replace our RPA.
Yeah. I'm hesitating. There's hope. There is a future. There is a hope. And the short answer is yes. The short answer is yes. The complicated part of it is Sam Altman went through this demo talking about booking this vacation. And then at the end, he was like, I would never use that to book my vacation. It was slower than me making the decision by myself. It was more likely to book the wrong flight. And I don't feel great about it having my credit card. So it's not ready. I'm open. Prove me wrong. But I've not seen RCM tools that live up to some of the wild claims, like you're going to cut your head count by 3/4 and stuff like that. Is it going to happen eventually? Probably. It's not there today. The point about, is it better than RPA? This is my hammer screwdriver. Let the screwdriver turn the screws. Let the hammer pound the nails. Those tools like read the web form and fill out the box on the web page and click the submit button. Inside OpenAI's tools and the other like forerunners, what they're using for web automation is not up to speed. It is not as good as a UiPath, Automation Anywhere, etc. It is not as robust. The computer vision is not as capable. What it is better at is the context of this app is to request authorizations. And I know it doesn't matter whether it's Availity's web page or this payer's web page or this other web page. There's going to be a box for subscriber ID. There's going to be a box for data service. There's going to be a box for free text. And the LLM will interpret service date, date of service, procedure date. Those all mean the same thing. And the LLM can be like, oh, I understand what goes in that box. UiPath's computer vision doesn't know the difference. You have to label it exactly as it's labeled. That's what the LLM, that is the nail for the LLM hammer. The nail for the RPA hammer is click here, type here, click here. The agentic thing, it is coming. It is a combination of the tools. And the maturity, I don't believe that it's there. Prove me wrong if people know better than that. I haven't seen it better yet.
Yeah, I get the agentic part because it's still new and everyone's starting to utilize it because it's actionable. It's the one that you should be scared of because it can start growing without you anticipating it. Like generative AI is very limited because it's only just researching and getting certain stuff, but this agentic AI, I was watching some examples where you put it in the middle and it starts building the workflow. With RPA, if you want to extend that workflow, you had to build another bot.
Yeah. Even 2 years ago, people were saying like, The ultimate end of AI is nuclear war, and the AI is going to decide its own thing, and we're going to end up in a nuclear war. It might happen. It might. It's not a 0% chance. Yeah, yeah. This is where the conversation always ends up. I'm gonna own more drink tickets for bringing this one up. 5 years ago, people were saying the same thing about RPA. We're gonna have bots approving charity applications. Pretty soon, we're gonna be writing off everything. It's the same concern. It's just you just need to have limits to your tools and put the bumpers around them. More questions? Are we at time? Yeah. For drink tickets, we're right at time. Okay, if you want to talk about it more, this will take you to my LinkedIn. So LinkedIn me, and I didn't tell a single dad joke. I made it the whole way without a dad joke. Give you a good one. Okay. All right. If you ask ChatGPT for dad jokes, it will come up with really good dad jokes. It doesn't actually know the words, so what it's doing is it's texting me personally and asking me to give ChatGPT a dad joke to put it on your screen. Okay, we'll end there. Contact me if you want to talk about it more.